Sunshine Coast Hospital and Health Service, meeting the challenges to deliver our vision of health and well-being through exceptional care. We're a region spanning more than 10,000 square kilometres, with a projected population of more than 470,000 by 2021. We care for more than 390,000 people over 7 sites. These include Caloundra, Glenbrook, Gympie, Maleny, Nambour and the new Sunshine Coast Public University Hospital. Our vision is to deliver the highest standards of safe, accessible, sustainable, evidence-based healthcare with a highly skilled and valued workforce that optimises the well-being of our community. Our multidisciplinary workforce is empowered by people who love what they do, embracing the challenge of attracting and retaining new staff to enhance our workforce even further. We're supported and encouraged as we transition to tertiary level care with the opening of the Sunshine Coast Public University Hospital. We've seen a 1.9% increase in revenue from last year, with a total of more than $600 million. The average cost of a patient is around $4,300. Today, more than 4,700 people are employed within the Sunshine Coast Hospital and Health Services. This is a combination of medical, managerial, administrative and operational streams. The Sunshine Coast is one of the fastest growing population areas in Queensland. We service a population of 390,000 with an annual growth of around 4% over the past year. The current projections have the population reaching over 430,000 by 2016. Aboriginal and Torres Strait Islander people traditionally view their health in a broad sense, which includes consideration of the physical, cultural and spiritual components of their well-being. The availability of health services and programs that are culturally and clinically equipped to provide health care for Indigenous people is a key factor that will contribute to closing the gap in health outcomes. There have been a number of clinical initiatives introduced. These include the refined cardiac care pathway, which has resulted in improved door-to-balloon time, the introduction of the Rapid Response Team in Nambour Department of Emergency Medicine, the Hearing Voices Support Group, the MPC Pilot Program, and the JEDI Program. The Musculoskeletal Pathway of Care Pilot Program assesses non-operative pathway patients through attendance at an outpatient appointment. A care plan is established in consultation with each patient and sent to their general practitioner with recommendations. The Geriatric Emergency Department Intervention Program began with a dedicated team within Nambour Department of Emergency Medicine to quickly identify patients over the age of 65 years old who would benefit from a comprehensive geriatric assessment. There have been new services introduced across the Sunshine Coast. These include dermatology clinic, liver scan technology, sleep clinic at Nambour and Caloundra, nurse practitioner at Gympie, telehealth, hospital in the home, and interventionalist radiology. The self-administered immunoglobulin SCIG program is the first public health service in Queensland offering patients the ability to self-infuse immunoglobulin at home. It's offered to 34 patients at Nambour, Gympie and Caloundra. It's convenient, quicker and less painful for the patient. The Preventative Alcohol and Risk-Related Trauma in Youth program's long-term aim is to reduce the incidences of trauma-related death and disability in teenagers and young adults. Sessions are held at Nambour General Hospital, engaging young adults and introducing them to emergency department personnel. The Research Strategic Plan 2013 to 2016 has been released, and the Sunshine Coast Academic and Research Centre has opened in Nambour. More than $500,000 has been committed to operationally fund research positions. The Sunshine Coast Hospital and Health Service is a learning environment. Clinical training is offered to nursing, medical and allied health staff. Graduate clinical education is supported across streams, and education for under- and postgraduate students is provided collaboratively with other education providers. The Emergency Department provides a simulation program called STEM, which stands for Simulation Training in Emergency Medicine. It's directed at senior house officers and is based on ASEM's Emergency Medicine Certificate curriculum. As a health service, we involve our consumers at every opportunity. Our consumers are represented on the Patient Safety and Quality Committee, the End-of-Life Care Committee, the Gympie Collaborative Network, the Gympie Patient Safety and Quality Committee, the Breast Screen Management Team, the Mental Health Consumer Reference Group, and the Mental Health Carers Reference Group. We are an organization in a rapidly changing environment, and we face many challenges. So what does this mean for us? It means that our services will increase. We will treat more Sunshine Coast people locally, as there will no longer be a need for them to travel to Brisbane for their inpatient care. There will be an increase in employment opportunities, more jobs for clinical and non-clinical staff. We have the people who will meet the challenges to deliver our vision of health and well-being through exceptional care. Exceptional people, exceptional healthcare.